Hello everyone, this is my first screencast of the year, an introduction to health law research, part 1, health-related secondary sources in Lexis, Westlaw, and beyond. The special topics covered in this are tailored to Law Offices 7 and 8. Law Office 8, you'll have to suffer through some discussion of safe injection facilities and vice versa for Law Office 7. So some of the goals of this screencast are to learn some next steps in research for your social justice project, receive a primer on secondary sources specific to your social justice project, safe injection or Medicaid navigation, and to get some practical tips to save time and keep track of your research. A few tips for conducting health law research: stay on track and learn as you research. Tip number 1, don't veer from your goal. So use folders in Lexis and Westlaw, but don't file it and forget it. One way to use folders is to save any files that you think are relevant to your folder in Westlaw. Lexis also has a similar folder system. Tip number 2, ease into difficult health-related subject matters. Start broad and move to narrow. So start, for example, Law Office 8, start with maybe a Medicaid entry in a national or state encyclopedia, and then maybe funnel down to the Medicaid manual, which will include a lot more detailed information when you know something about the law. And don't shy away from the state-specific secondary sources. Law Office 7, Massachusetts. Law Office 8, New York. Tip number 3, don't miss new developments in health law. I would suggest that everyone set some Google alerts, keywords, with keywords related to your project, and create some Lexis and Westlaw alerts. I'll show you how to create a Westlaw alert. You go up to the top of Westlaw, you click alerts. There are 2 types of alerts in Westlaw. There is a West Clip alert. As this loads, there's something called a West Clip alert, and there is a key site alert. What you do is you press Create Alert, and you press either West Clip or key site. West Clip is very similar to a Google alert, where it's searching for specific keywords as it comes up as new content is added to the directories. A key site alert is tailored to a specific citation. So you enter a citation and it will tell you whenever there's new content added to the directories that cite that citation. So this could be very useful for Law Office 7 with the Controlled Substances Act, because you could enter the citation to the Controlled Substances Act and pull up other new authority that cites that whenever it comes down. The same is true for Cruz versus Zucker for Law Office 8, or the Medicaid regulations. Whenever new content is added to the directories that cite it, it will come up in a key site alert. Tip number 3. Don't miss, that was tip number 3. Tip number 4, don't limit yourself to Lexis and Westlaw. Government and organizational websites are excellent resources for background materials. So the point here is expand your research beyond Lexis and Westlaw. New York Law Office 8, New York Medicaid website has a great introduction to Medicaid, all facets of Medicaid in New York. Take advantage of those. Okay, now on to some of the platform, Lexis and Westlaw specifically. Here are some advantages of Westlaw versus Lexis and vice versa. Westlaw has more state-specific secondary sources and has more CLE training materials, manuals or guides. Those are attorney training manuals, and they're practical toolkits for attorneys. Lexis has more non-legal resources, so if you're looking for scientific studies, it may be a better place to go than Westlaw. And it's better for, I think, it's better for healthcare industry news. So one thing that I recommend that everyone do, whether you're in Law Office 7 or 8, is set your practice area to health. And set it as your landing page. So when you open Lexis or Westlaw, or when you open your browser, it lands on the Lexis or Westlaw practice page for health. So what you do is you go to the Westlaw homepage and you go to practice areas, go to health law, And then you would bookmark the health law page. This has some really useful health-related case directories, trial court orders, regulations. This would be useful for Law Office 7 and 8. Administrative decisions, useful for Law Office 8. Secondary sources that are tailored to health. Let's take a look at those for a second. And once you're in the secondary sources for health, see how the health law is clicked here. You can go down to national or state related and filter down to some more specific secondary sources. You could click on treatises and text, which I'm going to show you in a minute. In Lexis Advance, you can go to this tab, this Browse tab. Oops, sorry. You can go to Practice Centers, Practice Area or Industry, scroll down to Healthcare. And this page provides some really useful top sources. For example, Affordable Care Act. And it may be that there, for Law Office 8, that there's some Medicaid-related information within the Affordable Care Act that you might want to take a look at. Next. So in addition to setting the practice area as health for both law offices, I'm now going to cover some resources for Law Office 7 and then for Law Office 8. For Law Office 7, the first process is to click Secondary Sources, focus on Health Law, focus on National Sources, and then Text and Treatises. So let's do that for a second and see what happens. In Westlaw, we're going to Practice Areas, we go to Health Law, we go over here to Secondary Sources, make sure Health Law is clicked here, click National, and we would click Texts and Treatises. This is pulling up hornbooks and textbooks that are specifically related to health law. I passed one out in class to for everyone to take a look at. Now, here is the list of secondary sources. Law Office 7, Controlled Substances Handbook. This is a handbook related to the Controlled Substances Act. How about the Drug Abuse and the Law Sourcebook? How about Health Law Handbook or the Health Law Practice Guide? Another option is the Health Policy Tracking Service Issue Briefs. If we click on that. Oh, Law Office 8, look, there's a Medicaid entry. Mental illness and addiction. This could be useful for Law Office 8. Let's take a look at some of these summaries. Mental health courts. I'm not sure how useful this would be, but it is useful for tracking policy developments in the law. What are mental health courts? Okay. So these are policy briefs. This may be more useful for Medicaid in Law Office 8 than it is for Law Office 7. Okay, so to review, to find some secondary sources relating to addiction, click Secondary Sources from the Health Law homepage, and on the side, click National, click Text and Treatises. That will take you to this page, and you can find the Controlled Substances Handbook, the Drug Abuse and the Law Sourcebook, the Health Law Handbook, Health Law Practice Guides, which could be useful for both law offices, and the Health Policy Tracking Service Issue Briefs. Next, from the Westlaw homepage, we're going to look for some state-specific secondary sources. Click State Materials from the homepage. Since this is Law Office 7, I'm looking at Massachusetts. And then scroll down to secondary sources. Massachusetts Continuing Legal Education Materials. Those are, again, attorney training materials. And here, we scroll down, see the Massachusetts Health and Hospital Law Manual, which might be useful for things like licensing and other state and local laws relating to the healthcare industry and hospitals specifically. But there's bound to be some useful information within these Massachusetts-specific secondary sources, and CLEs in particular. And finally, Law Office 7, I'm going to click back to the home page. I'm going to click from the Health Topical Landing page, Secondary Sources, and then search for Safe Injection. Okay. So, Secondary Sources. Then I'm going to click ADV, Advanced, which implicates the algorithm, Safe Injection, and I might do Safe Injection or Supervised Injection, because it could use either. We don't need the parentheses. And then we have a number of secondary sources that specifically pertain to safe injection or supervised injection facilities. Let's take a look. Canadian injection drug users, access to safe injection facilities, Journal of Health, Healthcare and Policy, harm reduction and the American difference, racial disparities in injection-related HIV, a case study of toxic law, the new local, which deals with safe injection, policy learning and local innovation in public health, a case for supervised injection facility, 2009, liberalizing the dialogue on international drug policy, drug truce. There's a great deal of helpful resources here for Law Office 8. You have 67 law review articles. That's a lot. Texts and treatises. There are 3 texts and treatises. Maybe we could just click that for a second and take a look at what it has. Marijuana decriminalization, bloodborne pathogens, maybe not so useful there. But we have a great deal of helpful law review articles. Okay, Law Office 8, it's your turn. Here is our first process. We're going to click Secondary Sources, focus on topic Health Law, Scope, National, Sources, Texts, and Treatises. There are a great number of useful things for you. Legal practice implications of the ACA, Medicare and Medicaid, Health Law Practice Guide, Health Policy Tracking Service, access to health insurance, Medicaid. So let's take a look. From the Westlaw homepage, we are going to click Secondary Sources. From Secondary Sources, we're going to look at practice areas. That's one process that we haven't done, really. So from the whole directory of secondary sources, click More Topics, go to Health Law. This filters us down. Okay, great deal. 174 sources. Click National. And click Texts and Treatises. We did this process for Law Office 7. Once here, let's take a look at the legal practice implications of the ACA. Legal practice implications of the Affordable Care Act, Medicare, and Medicaid. Even though Medicaid is a state program, it's administered through the federal government in part. So you're going to have to research the interplay between the federal and state dimensions of Medicaid. Possible changes in the ACA, Medicare, and Medicaid. Medicare and Medicaid basics. Let's open this up. Basics of Medicaid, super useful for you, and a whole bunch of useful annotations or entries on the basics of Medicaid. Okay, so to do this, I went to Secondary Sources, Health-Related Secondary Sources, national health law texts and treatises, and found practice implications of the ACA. Another thing we could do is look for the health law practice guide. So if we're at health law secondary sources, you can just click back here. And we were looking at texts and treatises. Texts and treatises. And we are looking at the Health Law Practice Guide. Health Law Practice Guide here. And can look to legal concerns of specific healthcare delivery settings, transactions, payment issues, operational issues. And if you look at legal concerns in specific healthcare delivery settings, we have long-term care and the Medicaid program, past, present, and future. Okay, so that's another option. Another option for ULaw Office 8 is to look at state materials, look to New York secondary sources, and look through New York practice, New York jurisprudence for Medicaid-related documents. And finally, Law Office 8, if you go to practice areas and you go to health law and you look at secondary sources, it can be very useful to search for Medicaid, if we do ADV, advanced, Medicaid and transgender and this will pull up some really interesting law review articles on the here's one, for example, 2016 Fordham Urban Law Journal, Fixing Medicaid to Fix Society, Extended Medicare Coverage of Gender-Affirming Healthcare to Transgender Youth, which was one thing that Kyle did want you to research. Okay, so I will distribute this list of processes for Law Office 7 and 8 to show you, to give you some additional help on finding health-related secondary sources. I will also include some helpful tips on finding these similar sources in Lexis. Good luck researching, and I'll see you in class.